It's been 2 years since the COVID pandemic brought our lives to a standstill, and we're still recovering. Tonight, we begin a new series looking at how we can heal. Liam Collins tells us how medical workers on the front line may never be the same as they continue coping with COVID.
They saw the darkest parts of this pandemic: extreme pain, deep emotional trauma, and tragic deaths. Nurses and doctors across the country have been on the front lines for 2 years. Now they say they're shifting to the realization that this virus will be with us for the long haul. That's the heart beating inside every ICU in America during the COVID crisis. For Dr. Minerva Covarrubias, it means there's still hope.
I had a girlfriend and boyfriend that were living together. We're planning on getting married. We're together for several years. Didn't get to it.
She believes she treated the first COVID case at Park Ridge Medical Center. Since then, almost 100,000 COVID cases have been confirmed in Hamilton County and over 1,000 people have died. But Hamilton County hospitals were seeing more than 300 patients per day back in the peak in September.
We really kind of had to change the entire environment of the hospital overnight.
Suzanne Hornsby is an ICU nurse at Erlanger. Just like Covarrubias, she has dozens of tragic stories. Parents leaving behind children, a husband and wife dying within weeks, a grandfather who did his best to try to avoid the virus, but then contracted it from his grandson.
He was like, is there anything that I can do to get home to my family? But I knew that there was nothing that we were going to be able to do.
They're painful memories they will take with them forever, ones that remind them to appreciate what they do have.
Their life was cut short. That's really what it comes down to. They were cheated out of a life.
Many of us healthcare workers were putting our living wills together. We were telling our family what our end-of-life wishes were.
When the pandemic began, questions about a path forward in the pandemic were not getting answers. Care became even more difficult as cases soared with few approved treatments. The ones that were had uncertain results.
People wanted to know specifics. What's going to happen to me? How are you going to treat me? And we really didn't know.
The Delta wave, when we had so many patients, so many people dying, and they were all so young.
Most of those bad memories are behind them. COVID cases have fallen to near record lows in almost every corner of the world. Healthcare workers are now coming to terms with having to live life with the virus.
We're all kind of hoping that it's going to end up being flu and COVID season, where, every year in the winter, we get a little bit of flu, we get a little bit of COVID.
This pandemic really brought out a lot of the weaknesses in our healthcare system.
Weaknesses like nationwide nursing shortages that got even worse when the pandemic hit. The American Association of Critical Care Nurses estimates 2/3 of nurses considered leaving their jobs. Nearly 1 in 5 already left.
It's broken a lot of us healthcare workers. I've lost probably 3/4 of my coworkers.
It's about nursing to patient staff ratios and being appropriately staffed. It was about having the right amount of PPE.
But even then, the hearts of Chattanooga ICUs beat on to provide the best care and to hold a hand when all else fails.
This has made me realize that I have to do this. I can't imagine not being here on the front lines.
It was always about reassuring the families. Like, you did everything. You gave them the full opportunity. You gave them a full shot, so they didn't have any guilt.
Did you always feel like you accomplished that?
I did.
The COVID vaccine is free and available to anyone, including booster shots. To find one for yourself, you can go to the Vaccine Tracker tab inside the Local 3 News app. In the studio, Liam Collins, Local 3.